The country has reached a milestone in the coronavirus crisis today as the number of new COVID-19 cases continues to rise. More than 200,000 Americans have died in the pandemic. There are nearly 7 million cases in the U.S. alone. This comes as the CDC changed, then later retracted, a web posting about how the virus spreads. Joining us now from New Staten Island, New York, is Dr. Eric Cioe-Peña. He's the Director of Global Health at Northwell Health. Doctor, thank you so much for joining us. So 200,000 deaths. I mean, the number alone is staggering. We thought we might get here. We hoped we never would, but here we are. What do we need to do to curb these cases?
Well, I think, thank you for having me, number one. But I think that the most important thing is to recognize what's worked over the past months, which is mask wearing and social distancing. The report that came out that showed that the New York City pause reduced transmission by 70% is important data for us to remember. We need to act while using the data about prevalence and test positivity to inform our decisions. I know everybody wants to reopen. We all want our economy to kick back up, but we can't do that despite rising infections. We have to be smart about this, and we have to use efforts that we know work, especially in areas where the prevalence is going up and not down. So certainly that is, I think, the take-home message going into the fall.
Mm-hmm. So let's discuss guidelines. We've talked about confusion over a lack of national strategy, but there's also confusion surrounding the CDC. What do you make of the CDC's latest walk back on guidelines when it comes to how the virus spreads?
Yeah, I mean, I'm not familiar with the inner workings of what happened at the CDC. I can tell you as a physician and as a public health professional, I'm very frustrated by the messaging that has come out in the past couple of days. I think it's really confusing for the public. I understand that there was some issues with drafts and whether drafts were ready for prime time, and that does occasionally happen in every organization. But I think what we need now is a clear statement on what the science is, which is that aerosols do transmit this virus, that mask wearing reduces aerosols significantly, and that we need kind of clear, concise messaging on how to prevent this. I don't think there's confusion about how to prevent this transmission of this virus. I think there's been confusion in the messaging.
Right. And now the CDC has put out guidelines for Halloween. So do you agree with those guidelines? And is there any additional advice you'd give to parents that was not included there?
I mean, I would say that the emphasis on interpersonal contact being the main mode of transmission is really the take-home message. We need to make sure that we're reducing interpersonal interactions with people that are outside of our family cohort or quarantine pod, if you will. The actual kind of worrying about decontamination of surfaces and candy and things like that really is not the main engine driving this pandemic. And that's kind of, I think, the message that parents need to receive is that it's much more worrisome that you're interacting with someone at their door than kind of getting Halloween candy.
All right. Well, Dr. Eric Cioe-Peña, thank you so much for your advice. It is certainly appreciated.